Hello everyone, my name is Dr. Ashok Kumar. I welcome you all. Today we are going to learn about the correctly and timely answering the USMLE questions. As we already started with the series, if you can have a look on the first slide about the USMLE and medical exams preparation. Under that heading, today we understand how we correctly and timely answer the USMLE questions or other medical exam questions, right? So generally what happens, you know that you encounter vignette-based or patient's case scenario-based questions, right? So generally there are 90 seconds, 1.5 minutes per question time. So generally what happens, you see there is a question stem that is starts, let's say, 55-year-old man visits the family physician, and you waste, let's say, 30 seconds or 40 seconds, around 40 seconds while reading this whole question stem. Then you read the options A, answer options B, C, D, E. So you come to know, the question is about anemia or hepatitis or respiratory disease. Then you go back again and read the question stem again, because almost all questions are similar. 55-year, 35-year-old, 38-year-old, blah, blah. Then in somewhere you find some systemic diseases. Then you read the options. But what I want to say, how we tackle this and how to save the time. Let's understand this. We don't need to read this stem cell first. We need to read the answers first. Let's see. So these are the strategies. First, quickly read the answer options. Why is that? Because once you read the answer options, your mind is ready in which direction the question is, correct? Then you read the question stem. So let's say I again write here, if you have a question about, same way, question is about 60-year-old women comes with the complaints of difficulty in breathing and so on, so on, so on. Or then patient's weak, well, later on you read. Instead of reading this, you first see the options A, B, C, D, E. So A option says microcytic anemia. B says macrocytic anemia. C, C option says hemolytic anemia, and so on. At least while reading these first, the answer options, it takes only hardly 7 to 8 seconds or 6 seconds quickly. Microcytic anemia, or for example, any other case, hepatitis A, B, C. Your mind is ready in that direction. Now you understand this whole story that is consuming 40 seconds. Now you have forgotten other things about other systems, hepatitis. You forgot respiration. You forgot brain disease. You forget about pharmacological effects, whatever. Because now you are focusing that patient is about some ask this question is asking about some diagnostic features, or because from this answer questions now your mind is working focusing on the blood related disease. You understand, right? After reading this 7 to 8 seconds, now your mind is prepared. Now you start reading this question stem, correct? After reading the question stem, within the question, now you can highlight the keywords. Then you can highlight patient head, dyspnea or breathing problem. Because of anemia this happens, right? Now it makes sense. If you had first read the stem cell instead of first reading the answer options, you would have been focused on respiratory diseases or congestive heart failure. But after reading these options A, B, C, D, you said, it makes sense. You are already prepared that patient is suffering from anemia, so you are focusing on anemia, dyspnea features, then pallor and etc. So you can highlight those uh, key words. And then women generally encounter microcytic anemia most commonly are old age people. Then you can go for that option, right? So after highlighting the keywords, then you can read the answer options again, A, B, C, D, E, but read the all options. Do not jump, it is microcytic anemia. Maybe you find other key factors down. So read all options and then you select the best option that suits you. So once you select the best option, since you first read A, B, C, D options, then you read the stem, question stem, then you highlighted important points, and then you understood what the question wants from you, the last line carefully after reading this, then you read options and select anyone. Once you select that, do not overwhelm, overthink, because many of the times students, what they do, they know it is, for example, they have come microcytic anemia to this option. They will overthink, and then they will cancel it again, jump to macrocytic. So overthinking also deviates you. Therefore, remember to stick on the point where your mind perfectly worked while working on this strategy, right? So after highlighting the words like this, then you can read again all answer options and select the best option. Correct? So that's clear. First, you read the answer options, then read simply in flow. Then you read the stem, underline or highlight the keywords, and then read the answer options and select the best one. Perfect. So let's go through this example. Vignette example one. Now, before you read, a 50-year-old woman reports experience frequent regurgitation. This can happen in many diseases. So what we understood, first read the answer options. Some experts will say read the last line also what the question is asking. So I would say if you read this again, you are wasting 10 seconds here, 8 seconds here, you are waiting one third of the time or one fourth. So I would encourage you just read the answer options because time is limited. You don't want to waste time back and forth. So read the first these answer options. So you read A, squamous cell carcinoma, B, adenocarcinoma, C, hypoplasia, transitional cell carcinoma, esophageal. It took only 5 seconds. Then you immediately think the question is directed toward the cell adaptation or some cancer. So you are not focusing on anemia, you are not focusing on hepatitis, you are not focusing on congestive heart failure, heart disease, you are not focusing on kidney disease, endocrinology, brain disease. No. If you had read the stem, question stem, you would have thought of so many systems and diseases. But since after reading these questions, answers first, your mind is ready to encounter some cell adaptation or cancerous process. Okay, that's fine, good. So now let's, after understanding this, your mind is ready for cancer or cell adaptation. Now you can read it perfectly. A 50-year-old woman reports experiencing frequent regurgitation, particularly when lying down. So regurgitation is there. Okay, regurgitation, acid from the stomach is entering into the esophagus. She is concerned about the possibility of esophageal cancer. Okay, she is concerned about the esophageal cancer. Good. As her father was diagnosed with it at a young age, so it means father had the also esophageal cancer. So she is afraid she might have familial genetic predisposition of esophageal cancer. Okay, you highlighted those words. She has been managing GERD, gastroesophageal reflux disease. So she had already heartburn, acid regurgitation from stomach into the esophagus for the past 3 years and is slightly overweight. It is just 3 years history, okay, and slightly overweight. Her, so GERD. Her primary care physician documents her symptoms and reassures her that she does not currently qualify for routine esophageal cancer screening. However, the physician will continue to monitor her GERD to help prevent any potential esophageal changes. To prevent the potential esophageal changes, the doctor prescribes a daily proton pump inhibitor, okay, to prevent further acid production from stomach, to prevent its effects on the esophagus. If left untreated, if this proton pump inhibitor is not given and acid is continuously going up to the esophagus, which of the following complication can develop in this patient? So you understand that acid can produce which complication? Gastric acid can produce which complication in the esophagus? So now you understand, is it a complication? What will be? A. Squamous cell carcinoma. B. Adenocarcinoma. C. Hypoplasia. D. Transitional cell carcinoma. E. Esophageal varices. What will be the correct answer? Do you know? You are familiar with. Correct answer should be adenocarcinoma. Why is that? Normally, what happens? But you read all options. If you jump, some people will say A, squamous cell carcinoma, because they think that this esophagus is lined by squamous cells. Yes, they are lined by the squamous cells, but the patient was suffering from what? From the stomach, there was regurgitation of the acid up there in the esophagus. Due to acid, these squamous cells, due to chronic irritation, get transformed, reprogramming of the stem cells. So now stem cells, squamous stem cells reprogram to produce now columnar, these columnar shaped cells, stem cells reprogram. So now there are columnar epithelial cells. Lower esophagus is encountering acid to be transformed to columnar epithelial cells. Now columnar epithelial cells, if they still encounter acid continuously, then of course columnar epithelial cells will develop, transform into columnar cancer, that we say adenocarcinoma. So B, adenocarcinoma. Right? That's correct answer. So now what I mean to say here, that from this case scenario, you prevent your wasting of time, prevented your wastage of time by reading first the options A, B, C, D, E. Now your mind was ready. There was some cellular changes, adaptation that towards the cancer, some process. So you read the case scenario accordingly, correct? So I hope this clarifies. So first you read the ABCD options, then stem, question stem, then underline the important keywords, then read again ABCD options and go for the best one. Okay, let's have a look on this another example, vignette example 2. So before reading this stem, please make this habit. Go through the options first. A, reduced intestinal absorption. B, decreased distribution to the brain. C, increased excretion in the kidneys. D, enhanced liver metabolism. E, elevated biliary recirculation. Now you are thinking there is some absorption, distribution in the brain, intestinal absorption, excretion in the kidney. At least you have some idea that's about some chemical compound or some drug that's absorbed or some distributed. Something is about pharma related, something. Now your mind is not distracted to other systemic diseases. Your mind is about some chemical compound, some or some drug. You're not focusing on anemia, hepatitis, cancers, etc. Right? So now your mind is ready in that direction, because you see stem is same. Again, an 18-year-old girl is brought to the doctor, but you are given a clue from the answer options within 6 to 7 seconds of reading. Otherwise, if you do traditional reading like many students do, they read stem and waste 40 seconds. Again, they read the answer options, then again they read, go back after reading the answer options, they again understand the case scenario, time is gone. And they answer wrong. So remember this. Now your mind is ready towards some chemical compound or some drugs. Now you read the case scenario. An 18-year-old girl is brought to the doctor by her parents after an hour of experiencing a generalized tonic-clonic seizures. Good. During a soccer game. She is not currently on any medications. A physical examination reveals no abnormalities. Following further evaluation, including 24-hour continuous EEG monitoring, she is prescribed carbamazepine drug. Okay, she is prescribed carbamazepine, anti-epileptic. The use of additional medications in this patient should be carefully monitored due to which of the following changes in drug metabolism. Now it says the use of additional medications in this patient should be carefully monitored. So you want to add any further drug, it has to be monitored due to which of the following changes in drug metabolism. So this carbamazepine drug is causing what effect, metabolic effects, that you need to monitor if you administer any other additional medication after initiating the treatment. So A option is reduced intestinal absorption. Will you focus on the reduced intestinal absorption of the carbamazepine that may affect the additional any other drug? Why it should cause? Carbamazepine is absorbed on its own. So this should not be correct. B, decreased distribution to the brain. If it is decreased or increased distributed, why it should affect the additional medication? Additional medication should be absorbed through the intestines and then pass through the liver, right? So the third option says increased excretion in the kidney. If it is increasingly excreted in the kidneys, it has nothing to do if the patient is taking additional medication. So this should not be correct again. D, enhanced liver metabolism. There is some doubt. It can be. E, elevated biliary recirculation. It has nothing to do again. If the carbamazepine is again recirculated, it has nothing to do with the additional medication interference. But D is highly matched option because enhanced liver metabolism. Once carbamazepine is administered in the patient, carbamazepine will cause cytochrome P450 system activation, right? So liver wants to catabolize carbamazepine and get rid of it. So this cytochrome P450 enzyme systems becomes induced, highly active to get rid of carbamazepine. Now what is happening? Carbamazepine entered into liver cells synthesized a lot of cytochrome P450. Now if the patient is given additional medication, this one, that will also be quickly catabolized because this enzyme system is hyperactive now under the effect of carbamazepine. Whichever is coming, carbamazepine is destroyed, other drug is also destroyed. If the patient, an 18-year-old, let's say she takes oral contraceptive pills, that will also be catabolized and destroyed by P450 system. So now, or any other drug, if you give, you have to escalate the dose, increase the dose of the additional drug because now cytochrome P450 is getting rid of any drug that is encountered by it. So now that means D option is correct. Enhanced liver metabolism. Enhanced liver metabolism is under the effect of carbamazepine, and because of that, other drugs efficacies can be decreased. If you add any other drug, you have to increase the dose. So you monitor accordingly, right? So what I want to say now, coming back after this discussion, what we understood here, we understood that you have to read first the options, answer options. Majority of the questions you will easily solve within due time with correctly directed mind. So you first read the A, B, C, D, E options, then you read this huge stem, question stem, and underline important key points because you already knew why do you underline the key points on the basis of again starting A, B, C, D, E options. Your mind is ready for that and you are picking those points in the stem, question stem. Then you just select the best option which suits you. I hope this clarifies. And remember that importantly, very importantly, read as much as possible, try to solve many questions. This will facilitate your brain to quickly be master in answering. How? By adapting this precious important strategy of reading first answer options, then question stem, and accordingly you highlight or underline the important keywords, then select any best option. Cheers, guys. If you have any other questions, you can contact me. The information is there on the link. Thank you very much. Have a great day.